I'm Dr. Joanne Watt, and during the year that we're discussing, I was chair of Corby CCG. I'm now chair of Northamptonshire CCG. This has been a really peculiar year. It's not been quite like any other, and obviously we continue to face the threat of COVID-19, and this is the biggest health threat that we've faced for more than a generation. Everybody has come together to support the response. There are so many people that have gone above and beyond to keep people safe, to keep the NHS and to keep the care system working. And I'd really like to thank everybody who has supported our fantastic local effort during these really testful times. It is a really hard ask of everybody, and we really appreciate everybody that has been kind to people in their community, kind to their friends and family, kind to health and care professionals, and more to the point, kind to themselves. So we know this has been a really difficult time. We would ask you to continue to be kind, and really thank you for everything that you're doing in these really testing times. So just really wanted to talk a little bit about some of the highlights from last year, some of the things that have been going on, and some of the basis on which we're now moving forwards together, building on the previous CCGs and all the hard work that was done by the organisations in the past. It is really important that we continue to protect each other. COVID is still a huge part of what we're doing, but there are obviously other health issues as well, and it's really important that we talk about those. NEN CCG and Corby CCG have been working in partnership for a number of years prior to coming together to form Northamptonshire CCG this year, and that partnership working has been really important and is something that I want to celebrate and discuss moving forwards. There are quite a lot of things that we've achieved, and in particular making sure that our patients get access to the help that they need, making sure that, oh, sorry about that, I've just realised I had a diary invite that came on. Okay, I'm going to start that slide again, if that's okay, Holly. It's really important that our patients get access to the help that they need, to the diagnostic tests, so things like x-rays and ultrasounds, and we need to make sure that we detect people who have long-term conditions like dementia. We look at all parts of the system. We look at the A&E department, we look at mental health as well, and we make sure that people don't wait too long for treatment, and that's something that we worked really, really hard on last year. We have enormous challenges that face us, so it is really important that people don't spend a long time in A&E. It's important that people move through the system really well, and that actually they recover from those illnesses as well. And so these are some of the areas that we're looking at moving forwards, and these are going to be a particular challenge from the point of view of response to COVID, and these are the things that are important to us and important to our population. We are pleased to have been rated as good by NHS England, and that takes into consideration all sorts of factors. But the actual important thing is, what are we doing in order to support care for our population? It is important that we take initiatives to make sure that we don't waste money, and certainly making sure that money is not wasted on prescriptions that end up in people's bedside cabinets and not being taken and doing people good, I think is a really important initiative, and that has saved money without having any impact on the well-being of our patients. And we're also particularly pleased to have established continuity for the midwives working with pregnant ladies in Lakeside practice in Corby, in order to give that continuity, which is really important as people go through pregnancy and also as they give birth to their babies. We know that the Corby Urgent Care Centre has been a really important part of our town, and we know that access to GP services is also really important. So looking at that 8 to 8 service, both from the Urgent Care Centre and also from the extended access as well, has been an important part of what we've achieved for our population, and particularly for those people who are working 9 to 5. It is useful for them to be able to get access to those services and to stay well rather than ending up in A&E. As we move forwards, it's really important that we work together as a county, and this is something that we've had a lot of conversations about prior to it happening, and our teams were working really closely together before the 1st of April when we came together to form Northamptonshire CCG. We are pleased to be working together. It's particularly important in our current fight against COVID, but it's important for all aspects of care in the places where you live. And this is all of the places of the county, and all of those places are important. All of them have their own peculiarities and interest, and it really matters to all of those populations that we do the right thing. Within our partnership, we do have a number of primary care networks, and these are groups of practices that have joined together to provide services for their population and to employ staff working across a number of different practices. And these are the 16 primary care networks that we have within our county and how they map. And you'll notice that some of those overlap. And so for some areas, you've got more than one primary care network working together. Breaking that down to the different areas within Northamptonshire, we've got 6 primary care networks, 2 in the Wellingborough and East Northants group and 4 in the Corby and Kettering area. And those areas are really important to people, and they have different needs for the population, and those primary care networks will be working together for those populations. In South Northamptonshire, we've got 4 primary care networks working together, and the needs of South Northamptonshire are quite different to some of the other areas within the county. And again, within Northampton, we've got another 6 primary care networks that are working together to look after the people who are in the borough of Northampton. So it's really important that we work together talking about place. Obviously, the place that I used to talk about very much was Corby, but understanding what a small place looks like, what a small place needs, is something that we can bring into understanding the meaning of place when we talk about Northamptonshire as a county, what its needs are, and how we support the population with all of their physical and mental health needs moving forwards. Thank you for taking the time, and thank you for listening.